Hello, my name is Lynne Dunbrack, and I am the Research Vice President for IDC Health Insights, and I run the Connected Health IT Strategies program. I just got off stage where I presented various frameworks that we've developed for our end user customers to help them as they endeavor to transform their mobile strategy. We also have a framework for mobile maturity that helps them understand where they are in the stage of this journey of mobile transformation. And then lastly, I talked about mobile security, which is very important, particularly when you consider the breach economics of a privacy spill. Well, we're definitely seeing our clients invest in these technologies, and they're looking at it both from how clinicians will use smartphones, tablets as they provide care for their patients, and also how they reach their patients. Patients have this expectation and consumers have this expectation of a pretty consistent experience across the different channels, whether that's the web, in person, or using a mobile device. And so a lot of attention is being paid to consumers and how we can better engage them to manage their health. Well, for providers, we see a lot of adoption and the use of these technologies. So 60% of physicians report using a smartphone, and 40% report using a tablet as they care for their patients. And the majority of them are actually buying their own devices to do that. Now, on the consumer side, adoption has not been as great as we would like. You know, they're certainly using the devices. They're using smartphones as part of their everyday life. They're using it to access the internet in more ways than they have before. But in terms of actual applications, on a worldwide basis, we see about 28% of consumers actually having ever downloaded an application and 7% using it on a regular basis. So we have a ways to go when we have consumers using mobile health applications on a wide scale. Well, I think one of the most important things is really a careful balance between security and usability, because if we don't balance this correctly and users find the security provisions to be too onerous, they'll try and seek out ways of circumventing that. And so I think in education of consumers and of employees and how they're using these devices is really very important. Starting out with a transformation framework is the first step that we recommend. And we have 4 critical measures that we look at. It's the strategic intent, it's people, process, and technology. And we deliberately have technology last. I think it's important that healthcare organizations, whether they're payers or providers, be able to clearly articulate what their strategy is, understand if they have the people and the resources available to execute on that strategy, see what impact mobile will have on their processes, have a good understanding of that, and then start to look at technology. I think it's very tempting for healthcare organizations to look at technology first, because there's so many questions that need to be addressed. But if we don't understand what it is that we're trying to accomplish, and if we have the appropriate people to do so, and what the processes are, we truly run the risk of investing in the wrong sorts of technology or not being able to scale to really effectively do the mobile transformation projects that we want to do.